NCOA was founded in 1950 by the National Social Welfare Assembly, a coalition of mainline human service organizations like the Salvation Army, Catholic Charities, and Lutheran Social Services, with a long commitment to serving those in need. This body recognized that the growing number of older people in our society required help and specialized expertise to meet their needs. Today, this commitment to serving millions of vulnerable and disadvantaged older adults remains our mission, animates and guides our work. Strategically, we are focused on helping the approximately 23 million older adults with the greatest unmet needs to achieve economic security, improve their health, and enhance their capacity to live in communities. NCOA also works to strengthen community organizations across the country, helping them to achieve greater impact, capacity, and sustainability. NCOA is committed to achieving several ambitious goals. By 2020, we will improve the economic status of 5 million poor or near poor older adults through innovative services provided by community organizations and online. We will help 4 million older adults with chronic health problems to increase their capacity to better self-manage their conditions. And we will protect and strengthen key public programs for disadvantaged and vulnerable older adults, especially Medicare, Medicaid, the Social Security, and the Older Americans Act. NCOA is relentlessly focused on maximizing social impact. We are rigorous in understanding the most important unmet needs of vulnerable and disadvantaged older adults. We are disciplined in addressing only those areas where we are well positioned to make a unique, major, and measurable difference. We achieve societal level change by focusing on 4 core competencies. The first competency is collaborative leadership. We bring together government, business, and nonprofit organizations to develop and implement strategies that improve the lives of millions. We are also great at advocacy. We improve policies by being a trusted national voice, by giving voice to those older adults in greatest need, and by combining the experience of community service with the policies for which we advocate. Our third competency is innovation. We are really good at developing new ideas and then testing them in communities and developing the evidence base necessary to influence change. Once we have a proven solution, we take them to scale nationwide. Our fourth competency is a deep understanding of effective services for older adults. We strengthen, expand, and sustain effective services offered in communities across the country. More recently, we have become really good at developing and bringing to scale online programs as well. The key resources that enable NCOA to achieve results are: 1, our moral capital as a highly trusted and effective national leader helping vulnerable and disadvantaged older adults since 1950. 2, a network of more than 14,000 community-based and statewide nonprofit organizations that provide services and advocate on behalf of older people in every part of the country. 3, an incredibly passionate and committed group of staff and volunteers. And 4th, diverse funding from government, foundations, corporations, and individuals. Examples of current activities that serve as stepping stones in our efforts to achieve long-term nationwide impact include our Economic Security Initiative. NCOA is working to improve the economic status of older adults living within 250% of the federal poverty level through community-based responses, improved public policies, and increased private sector investment. NCOA launched a national program to test comprehensive, person-centered approaches for improving the economic status of older adults, and we are achieving great results. Another example is our current effort to diffuse nationwide the Better Choices, Better Health self-management program. NCOA has enabled more than 100,000 older adults with multiple chronic conditions to complete this nationally recognized evidence-based program developed by Stanford University. Part of our strategy is to develop a public-private social enterprise that will deliver this 6-week interactive workshop online and in community setting for a variety of public, private, and philanthropic clients. NCOA is also working hard to strengthen public programs for vulnerable and disadvantaged older adults. Our advocacy priorities include improving economic security for low-income seniors, expanding home and community-based services, and ensuring that key provisions in health reform around chronic disease and long-term care are implemented effectively. NCOA also has major national initiatives in the areas of fraud prevention, mental health, mature workers, and reverse mortgage counseling. Our metrics are directly related to our social impact objectives. For example, through our efforts, how many low-income older people have improved economic status? To what extent were we able to increase their income or reduce their expenses? How many older adults with serious health problems are now managing their conditions more effectively? And how have the policies we have advocated for made a real difference in the lives of vulnerable older adults? NCOA has a 4-star rating with Charity Navigator, an A+ rating from the American Institute of Philanthropy, the top rating from the BBB Wise Giving Alliance, and we are rated a top high-impact charity in aging by Philanthropedia. We are laser focused on the needs of 23 million people over the age of 60 who are really struggling, whereas ARP is focused on 98 million people over the age of 50. During the last 15 years, we have transformed our organization and our work to focus solely on addressing the needs of vulnerable older adults. We are impact-driven, focused on strategies and initiatives most likely to fulfill our mission and objectives and generate large-scale results for older adults across the country. And we follow the approach of Jim Collins in Good to Great for the social sector. We are systematically building a great, lasting organization that is nimble, entrepreneurial, and deeply focused on social impact. Even though we are focused on the needs of the most vulnerable seniors with the greatest economic needs, our approach is one of abundance. We believe that there are plenty of resources available in our society to address these needs, the greatest of which is older people themselves. Since NCOA's founding in 1950, we have had a pivotal role in the development and broad diffusion of such seminal programs for older adults as Meals on Wheels and the Foster Grandparent Program, which are now found in thousands of communities across the country. Recent accomplishments include improving the economic security of low-income older adults. For example, since 2001, NCOA has helped more than 3 million people identify more than $11 billion worth of annual benefits they deserve through NCOA's online tool, Benefits Checkup. In the last year alone, we helped these seniors sign up for more than $360 million of benefits they were missing out on. Each year, NCOA also recruits and trains over 4,000 low-income seniors in 11 states and places them in subsidized community service jobs, and of those, half of them find full-time employment in the private sector. We are also working hard to promote healthy aging. As the Administration on Aging's National Technical Assistance and Resource Center for Evidence-Based Prevention Programs since 2003, NCOA has spearheaded capacity building in 46 states, the District of Columbia, and Puerto Rico, where programs to manage chronic illness, increase physical activity, reduce falls, and fight depression have reached more than 100,000 diverse older adults through more than 4,000 local organizations. Another aspect of our work is to foster innovative strategies for strengthening community organization. For example, NCOA supported 40 pilot projects across the country to develop and test replicable and sustainable models for engaging older professional volunteers in strengthening community organizations. We also developed an online tool that calculates the return on investment for these programs, which is greater than 8 to 1. We are also an effective advocate for public policies that improve the lives of vulnerable and disadvantaged older adults. For example, in 2010, NCOA played an important leadership role in successful efforts to get the Elder Justice Act passed. This law is designed to combat elder abuse, as well as other important provisions into the health reform law. Other recent advocacy victories include achieving $2 billion in improvements for low-income Medicare beneficiaries, achieving a $220 million increase in funding for senior employment and nutrition programs, and a $128 million increase in other services for vulnerable seniors. NCOA is currently working on major improvement to the Older Americans Act that will be reauthorized soon. The needs of vulnerable and disadvantaged older adults are tremendous and can be overwhelming. We have developed a variety of large-scale, high-impact projects during our history, but NCOA has always been reliant on private and government grant support, which waxes and wanes. We are looking to build a more diverse funding base. We have launched a social enterprise effort in the healthy aging to drive new revenues and are developing new kinds of longer-term multi-sector partnerships. NCOA needs seed funding to test promising new ideas and take the most effective programs to scale nationwide. An example of this is our soon-to-be-released economic checkup tool that will help millions of people improve their financial well-being. We also need growth capital to scale proven innovations, such as the Better Choices, Better Health online program developed by Stanford University that can make a huge difference in the lives of millions of older adults with chronic conditions. We also seek support for our policy and advocacy work, especially to give voice to the most vulnerable and disadvantaged seniors themselves, because we've learned that there's nothing more powerful than seniors expressing in their own words the challenges that they have and the needs that are unmet. We see great needs and opportunities that we would like to fill. For example, we would like to develop a more sophisticated research capacity so that all of us could have a deeper, up-to-the-minute understanding of the needs of vulnerable and disadvantaged older adults. This understanding would inform policy, innovation, and service programs. We would like to find additional ways to give voice to vulnerable seniors so that their concerns are heard not only in Washington, but in the 50 state houses as well. We see a tremendous need and opportunity to develop sophisticated online decision support tools that could help millions of older adults as well as their caregivers to navigate the maze and make much better decisions about health, health insurance, and financial options. With a one-time investment, we know that we could develop and bring to tens of millions of people tools that would make a huge difference in their lives. And we want to address key unmet needs of older adults that don't get anywhere near the attention they need, especially depression, access to dental care, and the need for better programs and strategies to help frail elders continue to live independently in their own homes.